Hi, we are AxisCare. AxisCare is a web app that aims at solving the challenge proposed by Evelyn's Health, which talks about investigating the gaps in the current healthcare system using the data that is using data which talks about different factors like location, access to facilities. The data sets that we use are provided by CDC and other public open government repositories. The analysis conducted through our project today is aimed at state officials, governments, and policymakers to help them make better informed decisions when it comes to the healthcare systems.
So we were able to find some really interesting insights from the data that we gathered. Most notably, we tried to understand how the critical staffing shortages are affected, and we actually found out that the COVID impact and the COVID cases really did put a huge amount of burden on the system, and we see a direct relation in the critical staffing shortages and the COVID cases. Additionally, we also see that states, even with the same amount of burden on them, performed differently, and some were able to manage the pandemic load better than others. Apart from that, we also tried and understand to help policy makers better make the decision of where they might want to put restrictions and lockdown and containments. So this is showing where the mobility is most and where you might want to focus on. We also tried to understand how the critical staffing shortages are affected by different state demographics and the let's say the race of the people and their political and cultural beliefs. And lastly, we were also able to deep dive on what are the different search trends to help policymakers plan better in terms of the diseases that might be upcoming, so that they can better equip themselves with the supplies.
Thank you.
Thank you.